No more vitiligo. Leukoplakia, also known as white spots or vitiligo, is a chronic skin disease caused by the immune system mistakenly attacking its own melanocytes, resulting in a loss of pigment in the affected area and causing the skin to appear whiter in abnormal patches. These discolored areas often become larger over time. Normally, our hair and skin color is determined by pigments produced by melanocytes. In leukoplakia, these melanocytes either die or stop functioning, causing the skin to lose color. Any gender or race has a chance to experience white eclipses, affecting 0.1–2% of the world's population, about 70 million people. Research has found that about 80% of white eclipses are related to genetic factors. The remaining 20% can be attributed to the environment or other factors. White eclipse syndrome is not directly related to age. Its onset can occur at any stage of life. It usually begins between the ages of 10 and 30 and is most common, but it can also occur in infants and the elderly. Symptoms of white eclipse include patchy skin, loss of pigment. This disease usually begins as well-defined oval patches. These patches may appear on the hands, face, and areas around openings in the body, such as the genitals. Premature graying or graying of hair. Vitiligo can cause premature graying or graying of hair on the scalp, eyelashes, eyebrows, or beard. Mucosal discoloration. The mucosal tissue inside the mouth and nose may also lose color. Types of white eclipse. Generalized vitiligo. This type affects nearly all skin surfaces, causing widespread depigmentation. Generalized leukoplakia. This is the most common type and causes depigmented patches to expand symmetrically over corresponding areas of the body. Restricted localized leukoplakia. In this type, only specific areas of the body are affected. This type usually appears at a younger age, lasts for a year or two, and then stabilizes. It usually affects only one side or part of the body. Acralfacial leukoplakia. Affected skin is primarily located on the face and hands, including the areas around the eyes, nose, and ears. What is the difference between white eclipses, sweat spots, and pityriasis alba? White erosion is an autoimmune system disease. The boundaries of white erosion plaques are obvious and milky white in color. They are common around the eyes, around the mouth, and at the ends of fingers. They are neither scarring nor painful, and there is no scaling. The hair on the surface usually turns white. Sweat spots are fungal infections of the skin. The boundaries of the plaques are blurred compared to those of white plaques. The surface is finely desquamated and appears in different colors such as red, light white, coffee, etc. When the plaques come together, the borders will be irregularly shaped like a map. This is common. For areas where sweat occurs, such as the back, chest, and neck, it may or may not leave a mark. Pityriasis alba is a mild dermatitis. It is common on the face of children. The skin will have flaking patches with unclear boundaries. The color is vaguely light white, and sometimes there is a little pink in the middle. It may or may not leave a mark. In addition, when dermatologists expose the affected area to ultraviolet light, the affected area will turn obviously white, but the spots or pityriasis alba will only show a slight fluorescent effect. Course of treatment: blister graft, transplantation of pigmented skin from one area to another. Tattoo, insertion of pigment into depigmented skin. Skin grafting, transferring healthy skin to the affected area. UVB phototherapy, stimulates pigmentation. Sorulin and ultraviolet light PUVA enhances melanocyte activity.